Hi, I hope you are well. This podcast is a place for people to share personal and professional perspectives, talk openly, and ask questions. From serious to silly to sublime, it's all about communication and connection. Always coming from a place of kindness and curiosity, we talk about shared humanity, discuss ideas, and highlight people creating a better world. We've got to keep learning, keep growing, keep being. I'm Melissa Beek, and this is Beek on Being. Today's episode is Beek on Being Skin Savvy. It's the only skin we're in, and we need to take great care of it, from enhancing your skin's natural beauty to repairing damage. From general skincare to cosmetic dermatology, we want to know all about prevention, protection, and procedures that can keep us staying healthy and aging well. Today in studio, we have board-certified dermatologist, fellow of the American Academy of Dermatology, and the director of Skin Associates of South Florida, Dr. Jolie Kaufman, to tell us everything we need to know about being skin savvy. I am so honored to have you here. So welcome. I'm thrilled.
Thank you so much, Melissa. It's fun.
Oh.
I said I could come and chat all day with you, so this is perfect.
I love it. I love it. Love it. So for our listeners, can you tell them a little bit about yourself and how you got into dermatology?
Sure. So my name is Jolie Kaufman. I'm actually born and raised in Miami and have actually known Melissa for quite some time.
Forever.
Since we were kids. And I'm a dermatologist. I work at Skin Associates of South Florida. We actually have 7 providers there, so it's not just me. We have a whole group of dermatologists and PAs and NPs. I started my career at the University of Miami, so in teaching, academics, and research, and now have rolled over into private practice. But still there, we do a lot of research. So
Right.
yes, we do dermatology. Yes, we do cosmetic dermatology, but we also do a lot of the FDA trials that bring new products, new drugs, new
Fabulous.
injectables, new Botoxes to our market in the U.S. So we have fun, and we all work together as a team. So it's
Yeah, your
nice.
team is amazing.
Yeah.
The best team.
Great.
The best team in the entire world. Okay, so I want to cover general dermatology to cosmetics, but can
Okay.
you just tell us first a little bit about the key aspects of general dermatology?
Okay. So, I mean, the thing that first attracted me to dermatology is because skin is just the window to the rest of the body. So really dermatology encompasses every single part of medicine.
Yeah.
So there are a lot of findings we see in the skin that we send people for, hey, maybe you need to see your cardiologist. Your, fingertips are getting blue, or you need to go to a doctor for your leg veins because we
Right.
see a rash on the legs. So the fun part about it is that it's a lot of problem solving. So we
always a
also
good
see,
puzzle.
so we see patients of all ages. That's the another wonderful thing about our job is that we can see babies. So there's babies that are born with birthmarks and skin diseases, genetic diseases, all the way up through adulthood. And that's when we start seeing more of the skin cancer type stuff as people get
Got it.
older. So it's enjoyable because it's different every single day.
Yeah, nothing's the same.
Right.
I love that. Okay, so we live in a tropical area. Does that factor in as far as dermatology conditions, like things that you see in this climate that maybe the northerners don't have?
Right. 100%.
Okay.
So we're in the sun every day.
Yes.
So a lot of people talk to me about, oh, shouldn't I just be lying in the sun for my vitamin D? And I say, yes, if you live in Seattle, I
Right.
would tell you, please go lie in the sun and get some vitamin D. But we're in the sun every day, no matter how much sunscreen we wear.
Right.
You're not going to block it out. So we do see more skin cancer, more rashes associated with the sun.
Right.
So things like heat rash, we call it PRP. Like we get a lot of like itchy things from sweating, things like that. Skin cancer, big one. Sometimes people with autoimmune diseases are more affected by sun, so this is a tough climate for them. Things like lupus, discoid lupus, those patients have a tough time in the sun. And honestly, we don't have that many seasonal changes here.
Yeah.
So whereas I work up north also in New York, I have to change people's skincare regimens by the season. So
Okay, I was gonna
come
ask you that
summer, I
too.
can cut back on their moisturizer at night. They can use more Retin-A. In the winter, they have to cut back on a lot of the drying things and add more. Here, we're kind of the same year round.
Yeah, except for
And
3
we
days
get,
in January.
yeah, and we get sun year round.
Yeah.
So, it's a different climate. It's a different practice of dermatology. Really.
Okay, so there's like 10,000 things you hit upon that I want to continue with. Table the skin cancer for a second, but you were talking earlier about like when you have patients and you can tell the skin that maybe there's something going on. Are there internal health indicators that can cause skin conditions? You just said a little bit about lupus or things like that, but
Yeah. I mean, absolutely. So one of the diagnostic creatures of lupus, one of the diagnostic features is skin rash. So they
Okay.
get a butterfly rash. So you go in the sun and you turn bright red in a butterfly pattern.
Oh,
So
wow.
across the cheeks and across the nose. So a lot of times, like even things like for transplant patients,
Oh,
we know in the skin that the transplant could be rejecting before they know in the transplant. So a lot of times,
really?
like at the university, when they have a patient that gets admitted who's had a transplant, if they're wondering if they're having graft versus host, which is
Right.
rejection of the transplant, they'll do a biopsy of the skin. So
Wow.
they don't even go to the organ, they look at it in the skin. So really, honestly,
Wow.
that quote of the skin is the window to the rest
Oh,
of your
yeah.
body or to your soul is actually really, really true. So it takes an astute person to really look, like when you're doing a skin check, to look at some features that might say, hey, maybe you should get your thyroid checked because your
Right.
skin looks very, very dry to me, abnormally dry,
Right. It's
drier
an
than I would
indicator for all
expect.
these other different
Yep.
diseases that are underlying health-wise.
Yes.
Fascinating. Oh my God. Okay. So back to the skin cancer part. How often should someone come in just for regular checkups?
Right. So in adulthood, so
Mm-hmm.
generally after age 18, unless you have a family history, you should
Mm-hmm.
start having a yearly skin check.
Okay.
In Florida, more important than anywhere else because we've already had 18 years, if you grew up here, of a lot of sun.
Right.
Most of our sun exposure happens when we're young.
Mm-hmm.
So
Yeah.
there are recent reports out about tanning beds, and they said that for people who used tanning beds before they were 35 years old, they're noticing a more than 50% increase in the chance of having melanoma. So
Melanoma, not just like basal or
not
squamous,
right,
like
not
full
even the
on
little
melanoma.
ones, the real ones. So
Oof.
we know that UV exposure,
Yeah.
UVB, UVA is associated with formation of skin cancers. Of
Right.
course, people like being tan, they like looking
Yeah.
good, and so we're attracted to do it. Plus, I love being outside.
Yeah.
It's nice,
Well,
enjoying
we
the
live here for
weather
a
and
reason.
yeah. So it's hard, but
Okay.
and God forbid you end up with something you really don't want it on your face. So please start there. The rest of the body we can cover sometimes. I wear a
Right.
lot of sun protective clothing.
Yeah.
But again, here every day, we're outside every single day. So you get enough sun to get a skin cancer, with a
Oh,
couple
yes.
sunburns. I
Yes.
know,
I know.
Melissa.
I know you take very good care
Yeah.
of me, though. Okay. So once someone has been diagnosed, let's say with basal cell or squamous, should they come in more frequently?
Yeah. So the rule would be once a year.
Mm-hmm.
Once you've had a skin cancer,
Mm-hmm.
it's every 6 months.
Okay.
And then after 2 years, you can go back to a year check.
Okay.
For melanoma, it's even more frequent. So you're pretty much on a 6 month schedule for the rest of your life with
Got it.
melanoma. The first 2 years after melanoma, most people will be checked every 3 months.
Okay.
The beauty of it is that most of the skin cancers, like basal and squamous, are very, very, very treatable
Yeah.
when caught early. So
Early.
that's
That's
why
it.
you do these screening things, that we find something little, you can go get it excised. And
Right.
unlike a lot of skin cancers, a lot of other cancers,
Right.
this can be cured. Like
Right.
you can be pretty much 100% cured by excising a basal cell.
I think what you said, though, is like get it done early.
Yeah.
Prevention is the key.
Yeah.
That's
The
it.
smaller it is, the easier it is to
The
treat.
more that you have been diagnosed with, does that increase the percentage of developing more skin cancer or a melanoma if it's just a basal or squamous?
The more sun you've had, the more your risk increases.
Okay.
So the fact that you've had a couple skin cancers means you've probably had a lot of sun. There are some other things that can cause skin cancer, like radiation. So
Okay.
years back, it's not in our generation, but the generation above us, they used to do radiation for acne,
Yeah.
which we don't do anymore. And then I had a patient one time who had a bunch of basal cells in her scalp, and they lived near a well where they actually had low, low, low amounts of arsenic in the well
Oh,
in
wow.
another country. Anyway, so there are other reasons, but really the primary cause of skin cancer
Is the sun.
is the sun.
So in cases like that, and maybe sun, does it make a genetic blueprint for offspring? Like if you have it, does that mean
No,
your children should
the
check
genetic
earlier?
part would be for melanoma.
Okay.
So melanomas definitely can be genetic and
Okay.
not just sun.
Okay.
So Bob Marley died of
Yeah.
melanoma on
Yeah.
his toe. So
Right.
most likely he did not get a lot of sun on his toe. And as
Right.
we know, he was dark. So it's not like he was sunburned all the
Right. Right.
time.
Right.
So there is a genetic component for sure. So if you have a
So
family history of
start earlier.
melanoma, start early. The other part of genetics would be if you're really fair skinned.
Yeah.
So, those people we call skin type 1 and 2, which are very fair, which means when you go in the sun, you
Wear a
burn.
hat.
Yeah. Wear a hat, I mean, I get it.
Yeah.
It's hard to apply
Yeah.
sunscreen. I just started taking up golf and I'm trying to figure out how you apply sunscreen after 9 holes when you're like
Right.
sweating and
Right.
and how do you recover your arms?
Yeah.
And sun protective clothing is nice. It's not so ugly anymore.
Right.
Like I have
Right.
cute ones that have zippers and patterns and
Right.
I think we've
I
gotten better
probably,
at
I
it.
guess that you're the chicest one
Yeah.
on the
Yeah,
golf
right.
course. I can
I'm the
imagine.
most
'Cause
covered one on the golf course,
Right.
but I still love being outside, and
Yeah.
I don't tell anyone to stay inside
Right.
because
But
of this.
protection.
Like, just be wise, like
Yeah.
anything else we do.
Okay, good. Okay, so you mentioned acne.
Mhm.
So can we talk a little bit about, in regards to acne, do you see it primarily with teenagers? Is there another population that, with hormone
Yeah.
influxes after pregnancies, or tell me?
So our classic picture would be teenagers when they're
Right,
going through puberty. So
right,
that's different for boys and girls when they
right.
start, and it's that T-zone kind of acne. But there are other types of acne. So perimenopausal acne for sure
Okay,
is a real thing. Hormonal acne is for sure a real thing.
okay.
There are some medications that can cause acne, so we always look at those
Oh, okay.
things. Most products are pretty wise now about being non-comedogenic,
Right,
meaning non-pore clogging,
right,
not oil, not based in an oil base. And so we less associate it with cosmetics than we do, with other things, internal things like hormones and stuff like that. But there still are, in this day now, you look at Instagram, it is every product in the world. I
yeah,
mean, I know even my daughter, who's 20 now, knows so much about skincare,
right,
and
right.
she'll be like, "No, you need to buy this one. You need." Where'd you learn that on Instagram? But be careful what you do.
Right,
Your skin likes to have a routine,
right,
so varying it up a lot is going to cause maybe not only pimples but also irritation,
right.
redness, sometimes even
Reactive,
dry, reactive,
reactive.
inflammatory kind of
Yeah.
skin.
Okay. So what are the treatments for acne?
I mean, lucky for us now, we have a lot of better treatments than
Okay.
radiation.
Right, right, right.
We always start with topicals. So we
Right.
go through a regimen with, face washes and topicals. If it's teenage acne, we usually start with a retinoid.
Uh-huh.
So a Retin-A, you've heard of that.
Got it.
And I know some people come in and say, "Oh, I can't use a Retin-A. It's too irritating. I'm going to get too dry." And it's all the way you use it.
Right.
So we have better formulations than we used to have. And again, your skin likes routine. So with things like Retin-A, you need to be on a routine, whether it's every other night or every
Right.
third night, whatever you can
Right.
tolerate. It needs to be a regular routine. But
Okay.
there's topical antibiotics, there's oral antibiotics, and happily, we still have Accutane on the market,
Right.
which is an oral form of Retin-A. It's a
Okay.
vitamin A derivative.
Got
And
it.
that's reserved for very severe acne or acne that causes scarring.
Right. Okay. So scarring. Let's say that they're done with their treatments, they're not breaking out anymore, but you have scarring, discoloration, divots, redness. How do you treat that?
So it's actually nice when it's in the teenage population because they grow a lot more collagen than we do. So treating them tends to be a lot easier and our results happen
More
a lot
successful.
faster. Yes.
Okay.
So, when we do a treatment on somebody, in their 80s, they're not growing a lot of
Right.
collagen. So it's hard to really get it, to bounce
Right.
back. But young people do really well. Obviously, our first goal is to prevent the scarring.
Yeah.
So if we need to use Accutane, we do. Some people just can't tolerate the topicals or their acne is so severe or cystic acne.
Yeah.
That's a very
Oof.
good indicator
yeah.
for Accutane. So some of the treatments we can do are fractional lasers. We do something called RF microneedling, which is a radio frequency with needles. So the needles pop into the skin.
Uh-huh.
They heat the underside of the skin. So the outside of the skin is left intact,
Okay.
which keeps it very safe from infection. And heating the underside of the skin makes you grow collagen.
Cool.
So you can literally treat those acne scars. And then sometimes if we get older and we're really not getting anywhere with the collagen stimulation, we can actually just fill the scars.
With a
So you
filler.
can take a little filler and put it into the scars.
Okay. And it doesn't create more dents or anything like that, or
And it doesn't create more
Okay.
dents.
okay.
So it's-
All right. So people want to know. Getting rid of wrinkles, age spots, discoloration, saggy skin. We need to get into cosmetic dermatology. I know there's so many things that I don't even know of because I'm a chicken shit. I don't do anything. So will you break down the different types of cosmetic treatments there are for enhancing skin, for looking refreshed, for rejuvenation?
So this could probably be like a 10 series
Okay.
podcast.
Okay.
So we'll brush like category, but
Okay.
like the deep dive is probably just, a lot. I think my first thing about cosmetic dermatology is that it's become a social media phenomenon.
Mm.
So you see all these social media experts online talking about what you should do. And I think it's fine to scroll, and believe me, they pop up on my Instagram
Oh,
all
wow.
the time. Because if you stop and look at something,
Right,
obviously
right,
I'm
right.
looking at skincare and I'm looking at,
Yeah.
things. And it's fine to scroll that way, but trust your provider. So find a board certified dermatologist that you trust that does this for a living.
I think that's key, what you just
And
said.
ask the questions you need to ask,
Right.
because unfortunately, we all know social media is fake, and it's fake in medicine too.
Yeah.
I always say, like, when someone comes in, they're like, why don't you put the Botox right here? I saw it on Instagram. They said, if you put it here, it's going to lift my eyebrow. And I said, do you walk into the cardiologist and tell them
Right.
how to do your cardiac cath?
Right.
Like, it's no. It's just
Yeah,
a no. It's not real medicine.
Right.
So, yes, learn, browse, skincare. It's great to educate yourself on skincare on social media. But,
Right.
like, when it comes to the real stuff, I go and just ask the appropriate questions.
Yeah,
And
I
then if
think
you're
what you
not
said is the
comfortable,
right provider.
yeah, and if you're not
Yeah.
comfortable with that person, ask another person.
Right.
But ask the questions. So, a broader view, the place I start with most cosmetic consults is that I tell patients what you do at home is as important as what I can do in the office.
Okay.
Because you may see me every 3 to 4 months, but you're at home every single day with
Yeah.
yourself. So your skin is yours and you need to take care of it. And so I designed a regimen up front. It's a big commitment, but once you get into it and you realize how great skin looks when you actually have a great regimen,
Right.
sometimes it saves you a lot of money from doing other things. After the skin regimen, we'll go into like kind of starter things. So there's something we call neuromodulators. That's a fancy word for the Botox type
Okay.
molecules. So we have 7 on the market now in the US.
Okay.
Botox was the originator. They're all made right now from the same botulinum toxin,
Okay.
Hall strain. So they're all the same active ingredient. They're just made differently. Again, up to your provider which one they want to use. They all work fantastic. They're all approved by the FDA. They have all been through rigorous trials with thousands and thousands of patients.
Okay.
So they're safe in my eyes when put into the right hands.
Got it.
The other type of injectable would be a filler.
Okay.
And there are 2 categories of filler right now. One is called hyaluronic acid. That would be like Juvederm, Restylane, those.
Okay.
They fill immediately. That's what we use in lips.
Okay. I was going to ask you, where are you
Yep.
putting the fillers?
So HAs, you have hyaluronic acid in your body.
Right.
It's in your joints, it's in your skin. So it's a natural ingredient in your body. They make these hyaluronic acids in a lab, so they're sterile, but they're very, very similar to what you have in your body. So the good thing about them is that, it's only a 1 pretty much in several 100,000 chance that you would ever react to it.
Right.
If that happens, we dissolve it and it's gone.
Does it dissolve naturally once
And
you
then
inject it?
it dissolves naturally. So
Okay.
your body recognizes it as its own.
Okay.
And it'll gradually break it down. So these things go away. The whole filler phenomenon about like migration of filler from, the nasolabial fold to the backside of the face is really not real unless it's injected very,
Wrong.
very
Okay.
wrongly.
Okay. So go to Jolie.
Yeah.
Don't go to
No,
other
these
people.
things, I mean, they're real medicines.
Yeah.
This
Yeah.
is not, going and getting your hair colored.
Right.
This is real medicine.
Right.
So pick someone wisely. So that would be one type. And then the other type that's become even more popular now is the biostimulators. So they're
What's
still
that?
injectables.
Uh-huh.
The 2 names that you would have heard of would be Sculptra
Okay.
and Radiesse.
Okay.
So these ones are injected, yes, to provide a little bit of volume, but they're more for collagen growing.
Okay.
So that same
So they
concept we talked
stimulate
about.
collagen growth.
Yes.
Okay.
Stimulate collagen. So we don't put these in the lips actually because
Okay.
they don't plump. They're more like tighteners, brighteners. So we call, things that we talk about like glow in the skin
Okay.
can be generated by these type of
Really?
fillers. So kind of
Okay.
a different purpose in my eyes
Uh-huh.
than a hyaluronic acid filler.
I'm curious, what are most people doing?
I would say it could be,
Combination?
it could be an even split. Like there are certain places I love certain things. So like
Mhm.
Sculptra,
Mhm.
again, collagen stimulator, the collagen grower, I love for the hollow of the cheek.
Okay.
So we have a frame, you have your
Mhm.
cheekbone and you have your jawbone.
Mhm.
And in between there, as we age, this starts caving in. And then
Got
we
it.
get all those crisscross wrinkles.
Got it.
Okay. And the more sun you have, the more you get that.
Right.
So there's like a great one on the internet of a guy who drove a truck his whole life, never used sunscreen. The left side of his face was exposed to
seen
sun
this.
and not his right
Seen
side.
this.
So you can look up truck driver, UV
Or look at
exposure,
my left arm
aging.
and my right arm.
Right. Same story, right, Melissa?
Right. All my cancers are on my cool arm, the
Yep.
one that was out the window.
Yep.
So,
And it's real. So,
So
all
true.
the kids now
So
who read
true.
are on Instagram saying,
yeah.
sun doesn't do any damage. It's the sunscreens that do damage. I'm like, okay,
Yeah,
read the
no,
real
no.
articles and then we'll talk.
Right.
The Instagram article is not good.
Okay.
Anyway, he has all the sun damage on his left side. But
Wow.
this area wouldn't really look good, you would imagine, with a water absorbing filler. Like
right.
you don't
Yeah,
want to
you'd
look
be-
puffy.
Right. Be like
So I
the
think,
blueberry girl.
yeah, again, the choices of where to put these things is
Uh-huh.
also needs to be decided by the person injecting you.
Right.
And it needs to be someone who's familiar with what they look like
Right.
and how they act and how they behave.
And the effect that you want.
Yeah.
Does anybody come in and say, I want something and it's just too much or too extreme, and you say to them that doesn't really fit with your face or
I do.
uh-huh.
And I'm okay with somebody leaving me for that reason and going
Right.
to somebody else.
Right.
And somebody will do them.
Yeah.
There's
Oof.
enough people in Miami that
Yeah,
will
yeah, yeah.
inject somebody,
Right.
where they look, weird or
Right.
different or
Yeah.
we see them.
Not authentic or natural.
But to me it's like an art
Uh-huh.
and
Yeah.
all the faces like to me are, part of the whole artistic side of
love the
it.
way you
So
look
if
at that.
it's I want somebody to look like them.
Yeah.
We keep pictures of people over the years so that you just look healthier,
Refreshed.
a little prettier,
Right.
a little younger, but
Right.
you don't look like a different person.
Right.
Because if you walk down the street, nobody recognizes you again.
Not good.
It's not great,
Okay.
I mean, believe me, I'd like to be younger and, with not a single line on my face.
Right.
But I think I might not look like me if I look
Yeah.
like that.
Okay. So chicken shit,
Yeah.
Frady, don't do anything. But I do have a huge routine. Like every night.
Yeah.
Every night I'm moisturizing. I'm doing whatever, like I'm from like my whole body. What can someone do if they are afraid to do the injectables or all of the things that you just said? Are there topical things
Yeah.
that they can do?
Yes.
What should we be doing to make sure that we're aging as gracefully as we can, or just keeping the skin looking fresh and feeling good?
So again, the first place always is a skincare regimen. Like if
Uh-huh.
somebody doesn't want to commit to that, you're
Right.
kind of throwing away money on the other stuff.
Oh, okay.
Because you're still aging every day.
Yeah, yeah.
And so if you're not going to do something about that side of it, I think you're going to be just chasing it
Right.
the whole
And
time.
disappointed with results
And-
anyways,
right.
because you're not going to,
Right.
yeah.
So you do a great laser, but then you don't wear any sunscreen and you don't use any topicals
Yeah.
and all the brown spots come back.
Yeah.
But that's, so if I had to design a perfect regimen, and again, it changes all the time because we get new technologies.
Yeah.
But I guess number one would be sunscreen.
Yeah.
So that's the primary thing. And I don't want to be like a crazy person about it. I wear it every day, but I still go outside
Yeah.
and I'm out there and I go on boats and I do things
have a
in the
life.
sun and
Yeah.
I live and I enjoy.
Yeah.
So my morning sequence would look like a gentle wash. Some
Mhm.
people even just use water in the morning.
Right.
And I'm totally fine with water in the
Yeah,
morning.
'cause you don't want to get rid of all the
Right.
natural oils.
Yep. Not good with water at night because we are exposed to a lot of chemicals during the day and pollution and stuff like
Mm-hmm.
that. But water in the morning if you have sensitive skin or a very gentle cleanser. I like all the antioxidant type products during the day. So if you
Okay.
can imagine, especially in
I'm
Florida,
making notes
we are
to
we are
make sure my routine
we're
at home is
outside.
okay.
So like if you're going to get free radicals or you're
Right.
going to get damage from pollution, from sun,
Mm-hmm.
it's generally happening during the day.
Right.
So that's when you want to protect yourself. And a lot of these things that we know about, like vitamin C
Uh-huh.
and the other antioxidants, green tea extracts, all these antioxidants also help protect us from sun.
Got it.
So you're adding another layer to your sunscreen.
Okay.
So I usually layer a couple. I do B, C.
Do you layer the sunscreen first?
No,
Or
your ingredients will be first,
Okay.
and then your sunscreen will go on top.
sunscreen top? Okay. Got
Yep.
it.
So, and then sometimes you can gauge it by your thinnest thing first. So
Okay.
you want them
Like a
to
serum
absorb.
before a
Right.
cream or a moisturizer.
You want them to be able to absorb
Uh-huh.
before you put the next layer on.
Oh, okay.
So if you put something really thick, like an oil,
Uh-huh.
which I have nothing against oils, but think about an oil as a sealant.
Right.
Like back in the day when they used to seal
Right.
the cars so
Right.
you wouldn't get
It's the
like
wax
any dents.
at the
It's
end.
the wax.
Right.
And if you put the wax on first, you're
Yeah,
wasting your
nothing's
vitamin C
absorbing.
by
Right, right,
putting
right.
it on top. So And some of the hyaluronic acids, believe it or not, act like a wax also. So
Really?
long chain HA also seals the skin, which is wonderful, but you
Not
don't
your
want it to
first
be your
ingredient.
first
Okay,
step.
got it.
So do your little vitamins like vitamin C, vitamin B, the green teas, any of your antioxidants first, then start layering. At night, I still love the retinoids.
Yeah.
So there's a million of them, and it'll depend which one you can use by how sensitive your skin is or how dry your skin is.
Yeah.
So, and you can gradually get used to it. So you can just bump it up a little bit each year as you get used to it and tolerate it more.
Right.
Um, I usually alternate a Retin-A if I can't use it every night or if someone can't use it every night with another technology for collagen stimulation. So the
Like
newer
what?
technologies are growth factors.
Okay.
So TGF beta is a big one. And then another
And these
category
you can
now.
get like over the counter to put on
Yep.
at night.
Yep.
I'm making more notes.
So one of those products that I love that's like that is called TNS. It's by the people who make Botox.
Okay.
Um,
And that's just a topical you put on
it's
after you wash
just
your
a topical.
face. And then if you're not doing a
Mhm.
retinoid, you put that on.
Yep.
Okay.
And then the
What
alternating
does that
night, a
help with?
retinoid, collagen stimulation.
Collagen.
Yeah.
Okay.
And then a newer type of growth factor is called an exosome. It's not
Okay.
a growth factor, but it's a collagen stimulator. It's a microvesicle that
Mhm.
really is a signal from a stem cell to tell you to do certain things. So the exosomes
Cool.
actually are anti-inflammatory as
Mhm.
well as collagen stimulating and elastin stimulating. So those have become recently very popular. So
Is that
that whole thing
also
didn't
an over the
exist a couple
counter
years
kind
ago.
of thing to get?
Over the counter.
It's not something that you have to go as far as a procedure in the office.
Right.
It's like, oh,
It's a
okay.
topical. So a lot
I
of
got to get new
them are
products
like
now.
medical grade, meaning a lot of them you can't just order,
Right.
on the
Right. Right. Right.
internet
Right.
necessarily. That's my other plug is that like ordering some things, if you're not ordering from the store itself on Amazon, you're just ordering from a vendor on Amazon, be careful. Like
Yeah.
these things, some of them are expensive. Like
Yeah.
one of the exosomes that we have in the office is $250 a vial. So
Wow.
they make fakes of these things. They
Yeah.
really do. Like even SkinCeutical
No,
products
if you're
have
investing
fakes.
in your skin, then you think you need to go
Yeah.
to a provider like
Yeah.
you or someone who
Or
has the
just order from the actual store,
right.
from SkinCeuticals or
Right.
from Skin Better. That's another one there
Oh yeah, they're
that's
both
that
good.
sells
They're
those.
both
But
good.
the exosomes are a new category. The most popular one or who kind of like started this whole phase was a product called Plated.
Uh-huh.
And it's actually made at Mayo. Like so
Oh
it's a real
wow.
product that was made
Okay.
in a lab and actually
More notes for me.
they were using these exosomes to
Mhm.
actually heal people after heart attacks.
Oh
So
wow.
a lot of these things come from real medicine
Mhm.
and then we translate them into how can we get these into
The
the
benefit.
skin?
Yeah.
Yeah. How can we, put them in a vehicle that will work
Mhm.
well in the skin? How can they stay stable in a vial and without refrigeration and
Right.
things like that? So that's the tricky part, I think, to products. So
Okay.
just because you buy a vitamin C that says vitamin C and it's $150, but then you find one that says vitamin C and it's $20 doesn't necessarily mean they're the same.
Right.
So vitamin C happens to be a tricky one that it can be unstable and it's supposed to be in a dark glass container
Yeah.
unless it's stabilized with something else. So I think a lot of these ingredients, even though they're in there, you want to make sure they're actually really working and
Right.
really able to get into your skin.
Right. Okay. That's perfect. So other treatments at home though, not besides the topicals, what about things like the LED
Yeah.
mask and stuff like that? Are those effective or
Yeah. I mean, it's become a craze and
right?
there's great science behind LED. So I really do believe in it.
Mhm.
I believe in especially focusing on the areas where you need help. Like a lot of
Right.
people are under eye people that, are like, oh,
Right.
I'm happy with my skin everywhere else but under my eye. So maybe buy an under eye LED. Um, they really do grow collagen in a lab and they really do grow collagen in skin when you biopsy skin. I think it takes a diligent routine to
Right.
be able to get it, to use it effectively
To
where
the
you're
level
going
of
to see the
effectiveness that
result.
you want results.
Yeah.
Okay. So every day
Yeah.
or
So you
okay.
really do need to do it all the time on a regular routine. And
Got it.
and I don't think it's something that you do and you wake up 2 months later and you're like, "Oh my god, like
right,
I
right, right.
look amazing."
Right, right.
But I do think it's part of a regimen and it's a nice part and
And
it's
part of
safe.
prevention.
And right. And
Okay.
maybe we're growing a little bit of collagen, but it might not be clinically like hugely obvious when you do it.
Okay. Got it. Is there one in the office that you do that
So the ones in the office are a little stronger, but it
uh
requires you coming in
more
on a
frequently as
regular
well? A
basis.
regular
I would
basis.
say
Okay.
where that might be worth it is, the blue lights are very, very effective against acne. So they're
Okay.
antibacterial. So a lot of times, like in a pregnant patient where we
Mhm.
can't use a lot of the topicals, or you can't use oral antibiotics,
It's
or in
safe
a
to use
young
the blue
kid
light.
who's sensitive, they can come in for blue light treatments. And it would be twice a week, those kind of
Oh,
treatments.
really? That
Yeah.
frequent?
Mhm.
Okay, got it.
Yeah.
All right, perfect. All right. So what about things like, because we talked about vitamin C, what about peptides? You said something about hyaluronic acid, but what about peptides, microdermabrasion? Should these be part of our routine too? Like the not microdermabrasion in the office, but like the
The at
one
home ones.
that's home ones.
So the microdermabrasion is okay for exfoliation.
Mm-hmm.
I don't think it's like a huge collagen stimulator.
Okay.
It's nice as we age, we shed skin more slowly.
Okay.
So when you look at someone and they have like a nice light reflection off their
Mm-hmm.
skin, that's because the outer layer, the stratum corneum, isn't so thick.
Got it.
And so the light reflects better. So they look younger. And it happens naturally with young people. But as we get older, that stratum corneum gets sticky.
Okay.
And so it looks like uneven mounds of dead skin.
Oof.
And you can imagine that light doesn't reflect off
Yeah.
that as nicely.
Right.
So exfoliation is good. Um, Microdermabrasion, like an at-home like
Mhm.
scrub or
Mhm.
something, would
Yeah.
be a physical exfoliation.
Okay.
I personally prefer a chemical exfoliation
Okay, like
because
a
you're
peel
not
or
damaging
something?
the skin. So things you could use at home: Retin-A,
Okay.
one, takes stratum corneum off. Glycolic acid, so
Uh-huh.
like maybe a glycolic pad once a week
Okay.
to exfoliate. Lactic acid is even
These are better
more.
than the scrubs.
Mhm. So
Deeper penetrating?
no, not necessarily, but less irritating for sensitive.
Okay.
My thing, I have a couple scrubs that I really like.
Okay.
Like Elastin makes a scrub that I really, really like. Zoe makes a scrub that I really
Okay.
like. And it's because their beads in the scrub are smooth. So remember that old like
Oh, yeah,
yeah,
apricot,
the
whatever
apricot
one
scrub.
that
Oh
was
my
like
god, I used to do
taking
my
your
whole
skin,
body in that
everything,
thing.
but it was like removing layers.
Yes. So that has
That's
a
bad.
bead that is not even. So it
Wait,
has
which one is
jagged
the one with the
edge.
bead?
So Elastin makes one that are
Elastin.
smooth, and so does Zoe.
But you also said you like the pads for
And I
cleaning.
like the pads.
Okay.
Yeah.
I'm gonna
I
have
do
to
like
call. I'm gonna have
once
to
a
call
week
you in the
pads.
office.
Like
like a new
they're
regimen
nice
that
and
I'm
easy.
starting.
And you do look bright the next morning when you do
Yeah,
those pads
yeah,
because it
okay.
takes that, just a little bit of dead skin.
Right.
For those people who have like thicker skin
Right.
or more oily skin, they can use the pads, those kind of pads more
Does it
often.
help declog the pores too?
Yes.
Okay. Yeah,
Yes.
I need to call you
Yeah.
about a new regimen, I
Are
think.
you kidding? No, you're good.
I love your regimen.
I mean, there's so many things, and you mentioned peptides, and
Yeah.
I like peptides too. Again,
Okay.
that's in the collagen stimulating category. It's a non-irritating
Do those come in
topical,
moisturizers and serums?
and they
They're
do
already
both.
infused. Okay.
They do. They come in both. So I would say
Okay.
like the high end one that's in that you might have heard of is Augustinus Bader
Oh
or
no, I don't
Augustinus
know.
Bader. They have that one's like super fancy one.
I have
But
like these skin
there are
cuticle ones that I
peptides in a
love.
lot
Yeah.
of Petox from
Mhm.
SkinCeuticals is a peptide. And peptides do lots of things. They make peptides that act like Botox.
Uh-huh.
So some of those peptides might be useful for places like crow's feet for that kind of wrinkling
Got it.
if you don't want Botox. So
Got it.
and again, Petox is one of those. But there are a couple companies that makes ones like that. But Olay Regenerist was one of the first peptides.
Oh yeah, that's right.
So
That's
a
right.
lot of these ingredients, it's very tricky, can be found in drugstore brands. And then you can also find them in $300 brands.
Okay, so someone's gonna say, "Why
So-
didn't you ask? Is there a difference between like La Mer or what? What did you just say about
Yeah.
the peptides?
In Olay Regenerist.
Olay, yeah.
Yeah.
What's the difference? And
So-
and should we be getting it more from like a Skin Cuticles or that Skin Better Science, or are the ones that are over the counter at Bloomingdale's?
Yeah.
Is
So
that just as efficient?
I think, I would say I have to waver on the answer. Sometimes spending more is better.
Okay,
And sometimes spending more is a waste. It just
Right.
depends on what product you're buying.
right.
Part of the regimen is your consistency. So
Right.
if you love the way it feels or you love the way it smells and it's going to make you use it,
Right.
I'm super happy with
Yeah.
you doing it.
It's
There are
routine.
some things that I use that, like, one of them smelled to me like socks. I mean,
Oh.
a super popular brand, but like, I don't know why. Just I put it on. I was like, oh, socks.
Oh, there's
like,
one. It
smelly
smells like
socks.
hot dog
Yeah,
water.
and hot dog. That's the same one to me.
It's the same one. Yeah, it smells like hot dog
No,
water
but so
to
if
me.
you're not, if it doesn't smell good and
I
it doesn't
still use it
feel
because I
good,
like the
right,
effects.
It's hard to.
I
it's
just
hard
wait
to
out
do
the
it.
smell.
Yeah.
It's terrible.
It's hard to go to bed like putting something on that doesn't
Right,
like
right.
make you feel good.
Right.
Um, but certainly there is some crossover, and
Right.
certainly marketing plays some role
Yeah.
in this. That being said, in a medical office, you'll generally see that your board certified dermatologist has done some research, and we generally choose things that have research behind them.
Got it.
So, SkinCeuticals was one of the first ones to ever
Mhm.
do that, but Skin Better Science also does
Yeah.
that. But it takes being owned by a very big company with lots of money to spend on research
To
to
be
be
able
able
to
to
do that.
create a brand like that.
Yeah.
So some of the pop-ups, while they look good and they feel good and they're super cool packaging and they're super trendy, it takes a lot of financial support to be able to do rigorous testing on a lot of these things.
Got
So
it.
if you're really looking for true science, I would kind of sway toward one of the companies that does more science-based products. But maybe if it's your moisturizer that you're putting on top of your science-based product, maybe pick what you love or what
Right.
smells great or what makes you relax at night
Right.
or something like that. So I think I would say like my face wash is inexpensive,
Right.
very inexpensive. In
Right.
fact, someone came to our office to sell us a face wash the other day that was $65, and I was like, $65. Like I'll spend 200 on my cream, but like
Right, right. Not on the face
$65 for
wash.
a face wash.
Right.
So I think you can find loopholes
Right.
and you
There's a
can
balance to it.
find like very good economic products like
Right.
sunscreens. The
Yeah.
Ulta line is beautiful
Yeah, that's good.
and they're very affordable. You do not need to spend $600 on each piece of your
Oh,
skincare
no, no.
in order to see results.
Right.
You just don't. But you may have a couple pieces that you
Yeah.
really
They're
that
investments.
right.
Yeah. But that's
Yeah.
okay. You're investing in yourself and your
Right.
skin. Yeah. So should we change our skin routine as we age?
Oh, definitely.
Okay.
Yeah. So obviously when we're young, listen, the decrease in collagen production starts young. They
Okay.
they start detecting it in our 30s.
Really?
So it does start young, but we're really not looking to stimulate it that young. Like
Right.
what does a 25-year-old need? More bounce.
Right.
They're looking for more things like pores
Right.
probably and texture, closing the pores, or acne
Right.
control, or maybe some of them have redness from old acne, things
Right.
like that. And as we get older, our tune switches. So we
Right.
need a lot more hydration. We're going to be using a lot thicker products, especially postmenopausal.
Yeah.
That's a big drive. And for people who are not on estrogen,
Right.
estrogen's great for the skin.
Right.
And so it gets really dry as we start to go through menopause.
Okay. So changing it as we age, and then you said earlier changing it seasonally.
Yeah,
I mean, not for
maybe in
us. We're
Miami
down
we don't.
here,
Maybe in
right? But up
Miami we don't
north.
need to as much.
Mm-hmm.
In fact, even this week I was saying to someone, "Well, maybe we shouldn't do your laser in the summer because of the sun." And she's like, "I'm in the sun less in the summer because
Right?
it's too hot in
It's too
Miami.
hot. It's
I am
already
not
90
walking
some odd
outside,
degrees.
so
Yeah.
laser me now." So I think every place, is different
Okay.
as far as how much you have to change.
Right. Yeah, because if you're living up north in the winter, you're going to have to, and it's so dry, you're going to have to change up your moisturizing and things
Right.
like that. Okay,
Big
got it.
shifts. Big shifts up north.
So, what's the latest and greatest and newest thing in aesthetic dermatology?
So I think, like everything else, this longevity type
Mhm.
medicine
Mhm.
is focusing on not only rejuvenation but regeneration. Like
Okay.
how do we actually like make
Promote
new
that.
cells and grow new cells
Mhm.
and get those cells to act like young cells? So things we talked about already, there are topicals like that are
Right.
stimulators like exosomes and peptides.
Yeah, that was fascinating.
So
too, when you said
those are
that.
kind of regenerative medicine type products. We're doing a lot more microneedling, not just with the needle, but just using the needle as a way to get these peptides to penetrate. So peptides can be many different sizes, and if they're very big, they have trouble getting through the skin.
Huh.
So a lot of times you need a little bit of a needle, and there are little at-home ones that people
Really?
buy. Yeah, they're very very superficial, and you could do
That's
a
okay to
roller.
do?
It's okay to do. And
I
then
consult you on
and
anything. Like, got to call Jolie
well, if
first.
you have rosacea or you have very sensitive skin,
Yeah.
you
I'm
should
allergic to
do a
everything.
do a
Yeah.
little test spot
Right,
for me.
right.
But you can. It's not so much the benefit of the needle. The benefit is that you're creating
Getting
a
it in.
tiny channel
Mhm.
that you could put wonderful ingredients through.
Got it.
Again, and those people with thicker skin, more robust skin, oilier
Right.
skin do a little better with these kind of at-home invasive
Okay.
procedures.
Good
But
to know.
again, regenerative medicine is huge. So you see younger people coming in saying, I'd like to do things to prevent looking like my
What's a
mother.
good
I'm sure
age
that's
to
what my
start?
daughter says already.
No, but what's a good age to start all these things? If someone wants to do Botox or if they want to do any of the things that you're saying, is there a particular age that they should start working on that or prevention so it looks more natural as they're
Yeah.
aging?
So I think the whole term baby Botox kind of started this whole drive with the young
Okay.
kids. Like, I need to do baby Botox so that I don't ever get a frown line.
Uh-huh.
Um, I wouldn't put an age on it, but I would say mid-20s is
Okay.
probably the average age that
Okay.
you'll see people coming in and asking. I don't think everybody needs to do this in their
Right.
20s at
Right.
all. Like, I'm not Botoxing my kids,
It's each individual case or person.
But I have had people come in at 25 that are just they always squint and
Right.
they already really have
That deep recess.
yeah,
Okay.
like more accelerated aging in an area.
So
So
it
it
just
doesn't
depends on the
mean
person
yeah.
and their skin. Okay.
Again, they're safe in the right hands.
Right.
And as long as we don't abuse the whole
Right.
process, then I think it's a really safe way to prevent. So a lot of times to me, baby Botox means you're not going to do it as often as someone our
Right.
age. You're going to, maybe do it once a year with
Okay.
tiny amounts and just preventatively. And maybe 1 year you're like skipping it because
Right.
everything looks good and you're happy with the way you look. So, um, but again, I always start on skincare.
Got
So
it.
that's the perfect place to start. You don't need a lot of it. You just need the right products for your skin
For your
type.
skin.
So again, ask a lot of questions. Go see someone who loves skincare. I mean,
You.
yeah, there a lot of women are obsessed with skincare. Not only me, but I mean, it takes like trying things
Yeah.
and knowing what they work on and understanding the science
And what works for you.
and then you're right, judging each person.
Is there like a rare, fascinating case that you've had?
Oh my God, what? Miami's super interesting because anything can walk in the
Yeah.
door. We are the gateway to South
Yeah.
America and to the islands. So a lot of people fly in for healthcare into
Right.
Miami, which
Hmm.
is so fun. I mean, training at Jackson Memorial Hospital is like just like a
You've seen it
potpourri of
all.
every single disease. In fact, at Jackson, the dermatology clinics there have a leprosy clinic. So
Really?
that still exists, even though it's not as
I always
contagious
think
as
of
we
it as an
always thought.
island in Hawaii,
Right.
right, the leprosy colony there. I
It
didn't think
was.
about it
It
at
was.
Jackson. Okay.
And now that island does not have
Right.
leprosy patients anymore, and they can just walk in a regular door, and it's not as contagious as we thought. I mean, it's
Right.
contagious to people who are directly with them and live with them, but
So you've
and
seen
it's
amazing
treatable.
cases.
So it's an interesting. We have all sorts of infectious diseases here because our climate. We can grow
Yeah.
all sorts of things in this
Fun
climate.
things.
We never have a freeze season, so you
Yeah.
don't see those things.
Right.
People walk in the sand a lot, so a lot of times we see little, vermints that get into the skin
Ooh.
in the sand. Most of them can't get anywhere once they get in your skin. So
Right.
there's something called cutaneous larva
Right.
migrans that gets in. He
Ooh.
dies in the skin anyway, so we don't really have to do much to it. But it's a funny little rash that looks like a little guy traveling along your foot.
Oh my God.
So if you walked in the sandbox or something, you might have gotten
Right.
that one. But again, the fact that we're warm year round allows a lot of these things.
A lot of nice things to cook and
happen here.
grow.
So it makes dermatology very, very fun.
Okay. Will you tell us a little bit about the clinical research that you're doing and what's on the horizon for skincare?
Yeah. So we have a skin research institute at the office
Mhm.
where, a totally separate unit that's run, and all the doctors participate, depends on what trial. But again, a lot of the focus right now, so there are a couple new botulinum toxins that are being studied. There's a new one that we just finished the studies on that should be released maybe this year that's going to be a short acting, quick onset. So, when you get Botox right now, it takes about 5 days to start working, but it
Okay.
takes 10 days to really look the way you want to look. So if you
Okay.
have an event, you got to kind of think ahead. So
Okay.
if you have a wedding or you're getting married, you're going to kind of plan these things way in advance when it's going to look its best. So
Got it.
this new one that they were developing kicks in within 8 hours. So we inject it within 8 hours, it's in, but it wears off by 3 weeks, 3 to 4
Oh.
weeks. So or if somebody thinks, they forgot and they want it, or somebody who may have been a chicken all along and didn't want to really try one of the ones
So,
that might last
chicken
4
shit.
months,
Yeah.
you could try this one.
Uh-huh.
It's almost like just wearing it for a little bit and see if you like the way it looks. And then you could go
still
on
so
to getting a
afraid.
long acting.
But
So
I'm so supportive for
that's
everybody who
what
does.
right. That's one of the newest ones. There's always new fillers. Again, I think
Uh-huh.
the focus now is turning toward kind of this regenerative
Hmm.
type medicine. Like, how can we grow collagen? How can we keep our cells young?
The one that
Things
you were
like that.
talking about that came out of stem cell that
Mhm.
was sending signals to the body. That was fascinating
Yeah, the
science to me.
exosomes. Yeah,
Amazing.
yeah.
That's really cool.
So, and they're tiny enough that they can penetrate the skin.
See, that's really
So actually, they
fascinating to
just
me.
developed one for hair growth, which I have started. um,
Wow.
that's nice. Yeah. So it works differently than what we're used to when we use hair growing
Uh-huh.
ingredients. So this one's an exosome. Again, it triggers and tells the hair follicle, hey, wake up, start growing hair
So
again.
it stimulates the hair growth without
Uh
having to
huh.
have transplants or any of
Right.
those things. That's
Exactly. Yeah.
fascinating.
So that's an easy one to start because Rogaine's kind of messy. And
Right.
most of my patients, they'll start and then they're like, it makes my hair all greasy. And then I got to shower and I can't go to work on
And then
time
they're
if
not
I
going to
put it
really
in
do it.
twice
Yeah.
a day.
Yeah.
And so it's just hard to comply, but again, very effective.
Right.
It's also transitioned. A lot of people take the Rogaine, which is called minoxidil, by mouth now.
Okay.
So you can take a pill also to
No, but
grow
the
hair.
exosome thing is
Yeah,
fabulous to me. I think
exosome.
that's so
Yeah.
cool.
You'll hear more, and now your Instagram's going to blow up with
I can't
exosomes. Yeah,
wait to
yeah,
hear more about it.
yeah,
We'll talk after
yeah.
about everything too. Um, what is like the biggest beauty myth that you hear all the time?
Right now, honestly, again, people are getting their information from social media.
Got it.
So I think there's so many myths. I mean, the biggest one right now that I hear from the kids is that sunscreen is what causes skin cancer. And if you really are concerned about chemicals, I get it. Some of the sunscreens are chemical.
Right, but a lot of the
But
zinc
zinc and
ones,
titanium are
yeah,
not
that's not,
chemical, so
yeah,
there's no argument against using a zinc or titanium. And
right.
even the over the counter ones are nice. They're elegant. Like
Hmm.
CeraVe just made a new zinc and titanium that's light. It's not white at all. It's very
Okay,
thin, easy to use. And again, the Elta products have those in them
right.
too. They even make them for acne, so you don't have to worry about being greasy. There really isn't an excuse in Miami, in my opinion, to
Right.
not do it.
I'm laughing because before all of these new ones came out, and I'm allergic to like half the things that were in sunscreen, I
Yeah,
would put like on a zinc thing,
right. You'd be
and
white,
whiter than white,
just
just be
pasty. Yeah.
pasty, glowing. My
And
kids would be like,
it
"What's
works
wrong with
because
you?"
what do the
Oh, I knew
surfers
it
still
worked.
wear? They
Right. Still
still
wear
will
it.
like do the zinc
Zinc all over them.
when
Yeah.
they're out for
Yeah.
5 hours
Yeah.
on the water,
Absolutely. Yeah,
So
because it doesn't come off so
yeah,
easy.
right.
Yeah. So funny. Okay. What do you wish your patients knew?
Um, I wish, and we already touched on it a little bit, but it's skin is your biggest organ, and you can reach it topically. So you can reach it, and you can have your own effect on it if you're consistent with it.
Right.
Whereas a lot of the other organs, we can't do too much about it. We
Right.
don't really see the results immediately.
Right.
Like, this is so gratifying
Yeah.
to commit to something so easy, like,
Yeah.
just switching around your regimen a little bit. And in Florida, I think also, I wish people knew that some of the lasers actually act as not only beauty, making you look better, but they're also prevention of skin cancer. So they've
I
done a
didn't
lot of
know that.
research now
Uh-huh.
on Fraxel, which is one you've probably heard of.
Yeah.
We do the whole face. Basically, the whole top layer comes off with the Fraxel treatment, and it takes all the precancers off also. So while it's not approved by insurance, so it won't be
Right.
paid for, it's
Right.
a cash payment. They have actually looked at patients who get a lot of skin cancers and showed that if they were consistent with doing a Fraxel, periodically through the year, that
Hmm.
they would reduce the amount of skin cancers
The
they have.
Fraxel's the peel or a laser?
It's a laser peel,
It's
so
a
your skin
laser
comes
peel.
off, but it's
Is that what I'm
laser.
doing?
What are you doing, Fraxel?
I'm coming in to do something to get rid of all the cancers on here.
Oh, yeah, yeah.
Everybody's like, I don't know, whatever you told me to do. So I was like, okay, this sounds
That's it.
fascinating.
It's Fraxel.
Okay, that's what I'm
It
doing.
is.
Okay.
There are lighter ones, so you
Hmm.
could do something like it used to be called IPL, intense pulse light. Now
Uh-huh.
it's called BBL, which is
Okay.
broadband light, and it takes brown off, it takes red off, so
Right.
it'll take off sun damage, but not necessarily all precancers.
Got it.
So that one's a little bit different.
That's
But
cool to know.
again, for people who are at risk, we know that the topicals help with prevention and that the devices, so things like the Fraxel laser, will also
Right.
help. I
So it's
think,
important to get the right
you
information
know,
from the
yeah,
right doctors
you
and
know,
yeah.
the industry, I'm not that old, but the industry has changed so
Oh yeah.
much, and there's so much research going into the
Yeah.
skin. I think because we realize that we really have access um, to so many ways to improve the skin. Again, not only for beauty, but for health.
Right.
And they're equally important.
Yeah.
And it's an investment that's worth making
Well
for
worth it.
sure. Yeah. Yeah.
Thank you so
Thanks.
much. This was so
Aw,
fabulous to have you
thanks,
here. Did I
Melissa.
leave anything out?
No,
You're
I
such
don't
a
think
wealth of
so.
information and knowledge, and
I
it's
don't
so
think we
important.
even touched, but we'll do maybe another time. We
What?
didn't touch. So there's something they call energy-based devices. So that's
Oh,
like the
tell me
whole
this.
other
Tell me.
class. So that can include lasers,
Mm-hmm.
but it can also include tightening devices like radio frequency, which we talked about a little bit for
Okay.
acne, but also for skin tightening, body tightening, like post-baby, things like
Neck,
that.
belly,
Yes.
arms.
Yes.
Oh,
So
tell us a
like
little
there's
bit
a
more.
whole other class of things that we use. So one of like the most common ones we do in the office is called Ulthera.
Okay.
And that is focused ultrasound. So many different kinds of sound waves and radio frequency waves.
And quick
Laser is
recovery,
light
right?
waves that we do to help, again, generate collagen,
Uh-huh.
tighten the skin, stimulate collagen, shrink pores, things like that.
Is it a
with these
one-time thing or
devices.
multiple
So
times?
Ulthera is a one time. I do, you age through it, so
Yeah,
it's
yeah.
not a one and done for the rest of your
Right,
life.
right.
But I would say once every year would be
Oh.
about what you would want to do. For low face and neck, they got FDA clearance, meaning they not only showed that they were safe, but they showed that they were effective at tightening. And those are important keywords to look at when you do a device, is to
Yeah.
make sure that it has FDA clearance. That
Okay.
some of these things we see that people are injecting are not FDA cleared to be
Right.
injected. So,
And
be
it's sort of
wary of that.
non-invasive and the
So
recovery
the
time.
Ulthera is non-invasive. Remember how you look at a baby in the ultrasound like this?
Mhm,
What they
mhm.
did with the technology is they flipped it and they made a point of heat under the skin. So it does nothing to the outside. It
Right.
goes right under the skin. Literally puts a point of heat in your basically in your skin,
Right.
which is where your fibroblasts live,
Uh-huh.
and those are the ones that make collagen. So it tightens the skin and stimulates
Ooh.
collagen.
I
So
think that's
I
fabulous.
think obviously all these things work a little better if we start younger.
Yeah, sure.
It's not great if a 90-year-old comes in and is like,
Right.
"Oh, I'd never done anything.
Right.
I'd like to
Right.
start."
Like to start
Right.
now. Right.
But there are always
Right.
things that we can do, but it is when your collagen is growing,
Right.
it's a good
The
time to
best
do
time
these
to
kind
do
of
it.
things. Yeah.
Oh, I love that.
Right. Anyway,
Thank you
thank
so
you.
much. I'm so honored to have you here. We could talk for hours about everything.
Thank
It's like
you.
you're a wealth of information and
Oh,
knowledge, and I'm so lucky that you're in my life because I
thank
know I
you.
call you with 1,000 questions,
No,
but you've
it's
guided me
awesome.
right for a million years, and I
Ugh.
appreciate it.
And I feel so lucky, honestly, to like even get to chat, but also honestly to be in such a great field. Like I encourage
Yeah,
any young physician who's looking at dermatology. Like I couldn't be happier with my job.
that's so cool.
And I think in general, when you love what you do, you just keep on
Yeah,
reading more and learning more.
yeah.
And any young person
And
who
your
wants
patients
to,
benefit
yeah,
from it.
yeah.
Oh, thank you.
But
Thank you. Before I let you go, I do one last thing with my guests. Are you game?
I'm game.
Okay, quickie questions. Real quick.
Okay.
First thing you do in the morning.
Check my aura ring.
Oh, you do? I love that. That's
Yes.
cute.
But I didn't want to say it because second thing is my vitamin C. But I
Yeah.
wash and then my vitamin C.
Okay.
I have this vitamin C that I love that when I put it on, it makes my skin look better.
Ooh.
So I can walk my dogs with like literally like out putting anything on in the morning and just feel like I look
Oh, I'm going
refreshed.
to ask you off
I
air
know.
about that too.
Yeah.
Okay. All right. Most recent read or a book recommendation that you have?
I'm reading Belle Burden's The Strangers. Have you read it?
No.
Okay. It's a true story,
Yeah.
very well written. Thank you for being like such an honest storyteller. But it's a little, it's our age. It's a story about a woman our age and her whole life gets turned upside down. And it's
Oh,
a true
wow.
story. But she shares, and it's like a nice learning thing to see what she went through. And I find her to be incredibly courageous
That's so
and
awesome.
interesting. Anyway,
Okay. I have to check that out too because I'm a big bookie person. Where's your happy place?
Wyoming.
Oh, I love that.
Total polar opposite of Miami.
No, but that's great.
Middle of nowhere.
It's just
You know,
gorgeous.
beautiful air. You could wake up in the morning and it'll be 30, and by the end of the day, it might be 80. Like,
That's okay.
you just never know what the weather is going to be. It's
Oh, but
kind of
it's
fun.
gorgeous out
Yeah.
there. Oh, that's a good one. Okay, what's your favorite journey?
Oh, we did my favorite trip. We did a bike trip in Normandy with
Oh,
our
wow.
children.
That's
And they,
cool.
of course, said, I do not want to do this.
Right.
Why are you taking us biking?
Right.
Like everybody else is having fun on Mykonos partying.
Right.
Like, no, you're going biking with us.
Right.
And they still say it was their best
The
trip.
best trip ever. Oh, I love that. That's so good. It's usually the one you complain the most. You have the best time when you
Right.
get
You're
there.
right.
Is it?
Where I can say, I told you so.
Right. That's always good. Okay, last time you really had a good belly laugh.
Ugh. I have a best friend who's my mom. Our parents met us growing up in strollers.
Aw.
Like the parents were walking in the neighborhood. So
Yeah.
we met when we were born. And honestly, anytime I'm with her, like we just laugh about everything. I think the husbands are so annoyed with us. 56 years later, they're
I love
still
it.
annoyed with us. But it's just like I
Oh,
think it's
what a
always
gift.
who you're with,
Yeah.
you know?
Yeah. But that's a really incredible gift to have someone that close that you could just be your authentic self and
Yeah.
just giggle and just, yeah.
And usually we laugh about like nothing.
Right. Or the husbands.
Yeah. Or them getting annoyed at us.
Right.
Yeah.
Oh, thank you.
Oh,
Thank you so
thank you,
much again. I
Melissa.
really appreciate it. I'm going to do my
Thanks.
outro and we'll talk after.
Thank you.
To our listeners, thank you so much. So grateful you're here. Keep listening, keep learning, keep laughing, keep up with Beek on Being. Listen to Beek on Being wherever you get your podcasts. All episodes are automatically transcribed. DM us to share thoughts, ideas, or nominate a guest. A big shout out and a huge thank you to Stephen Chan at Penthouse Studios. Woo!
Yay.
Beek on Being was recorded at Penthouse Studios and is a proud member of the Penthouse Podcast Network. Oh my God, that was awesome.
Thanks.
So great.